Welcome to this meeting of the Family and Children's Services Select Committee. I'm Councillor Will Pascal, Chairman of the committee, and I'll be chairing tonight's meeting. The event is being live streamed on YouTube, and members of the public and media are welcome to watch the meeting remotely and listen to the discussion taking place. Now, I'd like to welcome all those to Committee Room 1 at Kensington Town Hall and everybody watching on YouTube. Before we proceed with the meeting, I would ask everyone present, please make sure your mobiles are set to silent or switched off. We will start 72 seconds of silence. Remember those who lost their lives. So, first of all, apologies for absence. We have received apologies from absence from Kathleen Williams, and I understand from Councillor Emma Deckhouse. That's correct. Any other declarations of interest? Does any member have an interest to declare? Okay, thank you very much. So the minutes of the previous meeting have been circulated. Does the committee agree that the signed as a correct record? Agreed. Yes. I've got one point I wanted to ask Luke, which is just to make sure that any actions in the minutes were either completed or be put on the track.
Yeah, that's correct. The briefing's been completed, then it's one action on the direction.
Thank you. So now I was warned that somebody might not be able to make it in time for item 4. Are we all present? Correct. All right. Okay, so we'll go ahead with item A4, Grenfell cohort education outcomes. So,
well, have we actually done the minutes? Have we agreed them?
Yes.
Fine. So we're not, no difference.
No. In fact, we said we agreed them, and then I had to put it to us. There's a slight incorrection of order, but that was because the chairman was so slow, obviously. But thank you, given time to.
None of us could possibly comment, Captain.
So welcome to the table, and the protocol generally is that people have all read the papers, and therefore, if you'd like to make a brief introduction, either one or the other or both, to lead us into the paper, but we're not going to go through paper. We'll go around the table with questions. Thank you.
I'll just very briefly introduce Lauren, who has done all the work on this, so it's all thanks to her. I think it's really interesting what the results are and what you can see in the data that we've got here. Given that this service is, it's only started quite recently, hasn't it? Was in October 2024. So obviously this is sort of a review of what's been happening so far, and we're really coming to you to get your opinions and views of how you think it's working and any recommendations that you might have. So I'll hand over to Lauren to video, and thank you, Lauren. Thank you for all the work you've done on this.
Do you want me to highlight some specific things, or
2 or 3 points you really like to highlight?
the key stage 4 results are great
Yeah,
this year for Breathing Smart Children, and it's really hard to determine cohort across cohort because there's such different needs in each of the age groups. But I suppose given how impacted that particular cohort has been in their last year of primary, actually it shows that the interventions that we put in place over the last 7 years have had an impact and have made a difference in terms of their outcomes. And then we continue to have sort of good outcomes at post 16 for the breeding survivor cohort. And I suppose beyond that, it's also starting to think forward to what the new service is going to look like when it launches in September of this year. And that was the reason for my lateness, so I was interviewing. I'm scheduled with very odd hours to fit people's schedules. So I suppose I'm happy to take any questions anyone's got around it, but it's a bereaved survivors continue to access the support if they choose to opt in for dedicated service. That support continues to be made, and a deputy head who came into post in March, who's doing an awful lot of the groundwork to set up the hub in September. And we are driving forward with quite a lot of recruitment at the moment to recruit into the 10 posts that have been agreed by the bereaved survivors, immediate residents of the community, and school leaders who form part of the implementation steering group.
Okay. Well, I guess later in next year we'll need to hear a bit more about that when it's fully fledged, and we need to see the shape of that. But for today, if I could lead off with the question, not one of mine, but Kathleen, who can't be here tonight. She was asking whether there was a difference in outcomes between all of the between children who are tracked and children who sort of general.
It is such small cohorts.
Yeah.
Any comparison would be meaningless,
Okay.
because if we were to unpick each of the different cohorts, particularly at key stage 1 and key stage 2, these were really, really complex cohorts this year. There were really significant percentages of EAL, SEN, kids who've got education, health and care plans, a number of different diagnoses. To compare that to any other cohort wouldn't be a fair comparison.
I guess in key stage 1, that would be children who were born after.
It would be, but when you consider attachment and trauma, and you consider the capacity of the parent at the point at which they were born and how that will have impacted things like speech, language and communication, actually that is having an impact on development, and it's one of the reasons that the hub will have a speech and language therapist.
So you're saying that provided the needs are discovered early and early interventions put in.
That does go some way towards it. And then there are going to be some kids who've got specific needs that have different expectations in terms of their outcomes based on those needs. So you might have a child who's got a particular diagnosis where actually reaching expected standard is not their goal. And therefore to compare 8 kids to 800 or 8,000 would be meaningless, if that makes sense. They're very, very specific. And I think the other thing is we have to strike a real balance between these aren't looked after children, so they're children who have parents who are very active in their lives, and how much do we need to know about them? And it's a consent-based service, so we only get the information parents are comfortable sharing with us.
And I suppose that's definitely the case, because with BA such a variety of need that it's more to do with how good the people who assess the need or sense the need, probably, which is going to be the class teacher in the first instance. And
also, not all these kids are in borough.
Yeah.
So it's different education systems across different boroughs across the country potentially, and they approach things differently.
Yeah.
So it just wouldn't be I think we talked about it when I came last year, and I said it just wouldn't be meaningful to try and compare it to a wider cohort.
Councillor Noor, you had a question to do with the hub.
I have, Chair. Thank you. My question is, we know this borough has made commitment to look after those who are affected by Grenfell. And we know it costs some money to run that service. So my question is, how much is costing the council, and who else is contributing, including the national government?
It's quite I can't give you the breakdown of the individual pots of money, but coming out of the restorative justice pot of funding, which is 42 million, that's been divided 18 million for bereaved and survivors, 10 million for the immediate community, and 14 million for education and training across both bereaved and survivors and immediate residents of the community. I don't know off the top of my head what the percentage that we as a local authority have contributed to that. Central government has certainly contributed to that, as have all the other defendants who've been found liable. And that's the committed pot of money that was decided by lawyers and determined that it was going to be used as part of the restorative programme.
over 4 years.
I can get you the I can get the figures. I don't even know if they're publicly available.
So that's 42 million over 4 years.
Yes.
Yes.
And my second question is, the education hub is due to open in September 2025.
Mhm.
Will it be local school? Will it be based?
We're working on it.
Okay.
I can update you when we have the location confirmed. We're just in the middle of working out what's the best option. And there's some more information going to OSC, I think, next week that provides a little bit more detail in terms of how the implementation programme for education and training is going at the moment and where we're at. And certainly at the next update in 6 months, we'll have a location.
And my last question, which is quite short, is the cohort of year 13 who either will be going to university in September or into employment training. Those going to university, who's going to meet the cost? Is it the council?
No. So are we talking Bereaving Survivor cohort? So within the education and training offer for bereaved and survivors, 18 to 21-year-olds are entitled to £5,000 a year bursary, I suppose, through that £14 million of education and training package. That goes some way to contributing, and then separate to that, they have funding available through the dedicated service and their personal budgets, which can be used whatever they want, but all children and young people are able to access student finance, and lots of them are accessing scholarships and a variety of other things as well.
Thank you.
Tom, I think you wanted to ask. Yeah, well, my first question, I think it's been answered, was about those comments on difference between KS4 performance and KS2, but I think you said the cohort's so small that it can't really make a meaningful comparison. So my next question was just, so I know you said that the numbers are increasing, and it says work with 105 families at one point or another. Just wonder how many children are in the programme now.
225, but how many 50% families have opted out?
Right.
So it is now going to reach the point where it's probably going to fall below DFE suppression rates, and those kids would be so easily identifiable that we won't be able to report on it in the same way.
Okay. So so as those sort of numbers, as you say, those numbers are decreasing, you won't be able to report it in the same way. How will you sort of continue to measure success and value for money of the scheme?
We are working with the independent scrutiny function as they come in, and we were working with the external scrutiny team to design a range of different measures that I don't have off the top of my head, but I can go and grab my laptop, that look at a variety of different things, from how many people are engaging with the service, what are their starting points, what are their end points, looking at slightly more nuanced measures, because for things like speech and language therapy, it might be around confidence. For things like educational psychology, it might be around acquiring knowledge and understanding of what's going on for their child. And then there'll be things like looking at Key Stage 1, Key Stage 2 data, in-year assessments, looking at school reports, feedback from parents, feedback from children. So there's quite a wide variety. And when the new independent scrutiny function comes in next month, I'll be working through with them, along with my team, exactly what it is they think that needs to look like, and then that will adapt. But certainly we took a load of measures to the overarching steering group, or the Education Hub steering group, last week to initially agree how we think we're going to measure it.
Yeah.
And then as we implement it through September, October, we'll look at what needs to be adapted. With things like the mental health and wellbeing, or things like the Bereaving Survivor bursaries, there are 9 measures that we have against that, which range from things like improving academic performance to improving resilience, or increasing confidence, or improving mental health and wellbeing. And we track against what they use the money for, how that's made them feel on scales, so that we can report against those 9 measures. And those are similar measures, for example, to the mental health and wellbeing grants that have been given to schools directly, so that they have choice and control with what they're commissioning in their school for their kids, and the ability to adapt and change it. And they report on a timely basis against similar measures, so that we can do some tracking across the whole programme against those 9 key themes that were agreed with schools, bereaving survivors, and immediate residents from the community.
Okay. And can I ask one follow-up?
Can I just ask a supplementary on that one? That it relates back to what you were saying earlier on about each child being different, and such a small cohort, you couldn't therefore relate it to a statistical sample. One of the things that being a school government I've learned is that the duty we have to and the sort of keeps children safe in education and some of the Ofsted requirements is actually enabling each individual child to fulfill their own individual potential. And that sounds very similar to what you're talking about. But obviously in this case, there's a degree of involved engagement, which is not the case in perhaps normal everyday schooling because of the parental support that's been provided. But it would be very interesting to learn about those measures, those 9 parameters, and whether that could actually teach us something about how we should look at measuring school performance in more general vision. Because as we said in the council, is one of the things we've undertaken to is to learn from gradual. And if there's some professional practice here being developed, it would be useful to get that qualitative later.
Certainly, and we'll certainly be reporting to the independent scrutiny function on a termly basis for the kind of under 25 offer, and then the adult offer, which is obviously separate, will be reported on quarterly. So there'll be loads of data available.
Adults is not our responsibility in scrutiny. I think learning about emerging new professional ways of handling things would be brilliant.
Yeah. It's fine. That's my responsibility to the adults.
No, I was just wondering about the flexibility of the budget over the next 2, 3, 4 years, and I'm sure we've sort of fairly planned out the different elements as sort of outlined the report wants to deliver. But if after, as often happens after a year or so, actually say the demand for this element of it is much less than we thought, or whatever, do we have the flexibility to say, right, we're going to actually put more into bursaries, or we're going to put more into...
committed to do that. So we will have an operational steering group that will be established probably in September once it actually gets up and running. And we've committed both to Breathing Survivors and to immediate residents, community and to teachers that if something's not working, come and tell us. Let's look at whether or not we can change it. And if it's not working, then we're prepared to be very agile with the model and adapt to the needs of the community, because it's not about us or our egos, and it's very much about if what we're doing isn't working, if it's not being received in the way that, let's not forget they've designed it.
Yeah.
But if it's not been received,
what the future
100%, and if it's not been received in the way that they intended and it's not working, we'll change it. I'm not going to keep something for 4 years that isn't working.
Yeah. Okay. Thank you.
No problem.
Reggie,
Sure. Thank you, Chair. I had on page 11, 5.6, we talk about this stuff that's going to start in September 2025. What I wanted to know was, to date, how are these services catered? Were they before they have,
So how do kids access educational psychology or so for Breathing Survivor children specifically, or the wider community?
Both, actually.
Okay, so from an educational psychology perspective, and I'm maybe not the best person to talk about this, but we have a traded offer with schools. So we have an EP service that sits within the Enhancing Service and Education, and they will go into school and provide a variety of different services, consultation, a lot of the more detailed things we've done around Grenfell are in this paper. And a school will ask to consult with an EP on a particular child. For a parent to access an EP in this way, it doesn't exist.
Okay, so
the idea of this is that this is about parents having the freedom and choice to come and access professionals they wouldn't normally get access to at the point where they've got a question. Because for some parents, coming and having a conversation about why your 3-year-old can't connect 3 words, and that's a 20-minute conversation, and the speech and language therapist can say, do you know what, I'm running a workshop on that next week, why don't you come? And that then fixes the problem and empowers the parent to be able to provide the support in the best place where the child is most regularly. It's something that doesn't really exist in the system. So at the moment we have statutory services for all of these things, and there are a range of different services, certainly for speech and language and occupational therapy, that you can access earlier interventions, but not in the way where a parent or a child could come in and self-refer and say, I would like help with this.
Right. Okay.
That doesn't mean we're not going to triage, because we think need is going to be quite high, but it is very much about community resilience and building resource. So for speech and language, for example, we're looking at a model where it's building capacity in parents by providing workshops and training to them. So that over time, we've worked with 1,000 parents in the community who know how to support their children with speech and language, and that should then ripple out.
Right.
Yeah. And just to follow up, it was just to say that obviously this is available more generally as well through the schools. So it wasn't to give the impression that
No, just not from a Not from a very, not from a, you
Not
can't
so-
walk in and access
Yeah,
it.
no,
That
but the
makes
school
sense.
can sign
Yeah.
those and everything, obviously, to people to access these services, which comes up in the next paper.
And the other thing as well is all the services sound amazing. But I just had an overarching question of how accessible it is to parents and, you know, big and to children. And have we got any, I know it's still new, but to work out the efficiency of the whole process, not in practice, but cost effective as well.
I check, can you repeat the question, just 'cause I'm not sure
Yes.
I understood exactly what you're asking.
So my question is that the accessibility of all these services, is it very easily accessible? Is everybody aware of it?
So we've got a couple thousand people who've shown an interest in it. We'll be doing a lot of the same work we did through the consultation. So going out and doing door knocking, offering coffee mornings, offering drop-in sessions in that first term.
Right.
It will very much be about making people know exactly what's on offer so that they can access it. I'd also say we probably have a list of people who are waiting for it already because they know it's coming. Schools are very aware. The team are going to do a roadshow with schools so they can go in and make sure that all teaching staff and senior leadership are aware of exactly what's on offer and how they can signpost families. And we'll be doing the same thing. We've already been going out to kind of community services and having conversations with them about what it's going to look like. We'll share very widely the comms and keep doing more. If we're not reaching the right people, we'll certainly be checking on which postcodes and who's accessing and how many. And what age groups, and then do further work if we need to fill in anywhere where there's an obvious gap.
Right, and the child is my last question, and the people who opt out, are we able to track them or not really? So it's entirely the choice. So, but they can opt in, opt out. It's very
They
flexible.
can opt in or opt out of the dedicated service. They have access to the education hub once it launches, irrespective of the decision they've made with the dedicated service.
Right.
So it will be universal for bereavement survivors, and it's been agreed that they will be prioritised. So if, for example, there's a waiting list for a specific service, they'll go to the top of the waiting list.
Okay.
And no points. Sonia.
There was just a question similar to Councillor actually, about the function of the programme. So I assume this is on offer for children both in and outside the borough. So how does the offer differ? So particularly, the educational psychology service mentions going to schools, making sure they're aware of the support they can give pupils who are part of this programme. So in practice, say there's just one individual child in a school outside the borough, somewhere else in London, how do we handle that? Do we send a team of
For a bereavement survivor
specifically-
child,
Yeah.
yeah.
So that's school, so that, okay, so the offer is exactly the same, really.
It is bereaved survivor children, providing
Yeah.
they are within the jurisdiction in which that qualification is valid. Because don't forget, we have got some bereaved
Okay.
children who've come through since the civil claims who aren't living in the UK.
Okay.
So I'm not sending an EP
Yeah.
to
Okay.
wherever. But if we've got kids in Birmingham or Preston and there is an identified need with consultation with the school and they felt that actually an EP assessment was what they was needed, then yes, we'd send them to wherever they are.
Okay.
But just to add to that, one of the reasons for the hub was specifically for children who might be going to school outside of the borough.
Yeah.
That after school, there would be somewhere they could come that would be open within the borough for them to access services. Whereas the schools sort of close by, the 5 schools, they will be able to have the people in the hub go into their schools during the daytime. So we would try to design it so it's most flexibility to get all children to be able to access them.
But how would a child in Birmingham know that? Is there already
through the
part of the
dedicated
bereavement
service? So through the bereavement
they're
survivor
already
comms,
part of it.
yeah, we already know exactly who those kids
Okay,
are and who
fine.
those families are, and we'll communicate directly with them.
Yeah.
Thank you.
Okay, so no more questions from councillors.
Yes,
Yeah, David.
David, sorry. Did I miss you?
Lauren, 42 million over 4 years. How much have you spent so far?
Not a question for me. That's I don't know. A silly question. I have no idea.
But it's coming at different times. So as you can see in this paper, that part of the 14 million children already started, but the bit about the education hub isn't starting. So
We haven't.
No, that's-
We've spent some
a
of the
bit,
money,
but
but
it's
it's not very much.
no, so it's coming at different stages
Yeah.
that the money is being spent through. So the idea is that we were going to be over 4 years, but already we're seeing that it won't be 4 years since we agreed the.
And that
40
14 million is split, so 7 million for bereaved survivors and 7 million for the community. Off the top of my head, 592,000 is the figure that's been spent by bereaved.
Pretty a moment ago, I think it was talk about parents and it's the roughly half you said who weren't taking it up. What are we doing to increase that?
The dedicated service, we're not.
Is
So
there anything you can do? Because
We're not looking, so the idea is the
the
dedicated.
unknown unknowns, as it were.
So the dedicated service was set up and it was co-created by bereaved and survivors around empowering them to take and access the support they want. So actually 50% that feel they don't need a key worker anymore, which is what the bulk of that service is, that isn't something that we would view as a negative thing. And they know they're going to be able to access the hub irrespective of that decision from September. So actually, I don't think we'd want to. I think Simon would feel quite strongly. Yeah, I mean, that is what we're leading towards, is not having a cliff edge for them.
And different, but not wholly unrelated question, the last one. What do parents think that the dedicated services are?
In terms of education, or in terms of the whole service,
Overall.
Since it started.
Yeah.
generally positive.
I mean, and are they supportive, think it's well targeted, that it's
This is entirely designed by
Designed
bereaved
it.
and survivors.
that I absolutely accept.
Yeah.
But there would be some who would say that an awful lot of money has been spent on the bereaved and survivors,
Mhm.
but they're not sure how much has actually been achieved with the very significant expenditure. And I suppose my question is to be assured that whilst we are spending quite a lot on it, that we are getting returns commensurate with 42 million. Okay, it's not as much as that
So
yet.
I suppose that's the role of the independent scrutiny function, to ultimately provide assurance to not just you as the council, but actually to all of the other individuals and companies that are funding that. And they'll be producing quarterly reports in response to it. And I suppose we just have to wait for the first one.
And if I could also add that there is a division of responsibility scrutiny between OSC and FCS. We're focusing on the financial services side of that, not on the entirety of that.
Absolutely.
So I think your question in the context of OSC, with regard to the when OSC is dealing with the external scrutiny function and that question, that's really the nexus of it.
But surely it's a legitimate question to ask what parents think, because parents are slightly to do with having sure.
It is definitely a question perfectly valid. I'm not going to get the whole answer here.
I'm not expecting the whole answer.
Okay. Any more questions? Do we have any questions from members of the public or people are not present but not on the committee? Okay. So with difficulty, I'll try to sum that up. I'm sure that Luke's got this minute. But one of the subject to the hub is something that's a work in progress, and therefore we would definitely like to hear more about it when you've got more information to tell us, and that will probably be in the next corporate year. So this committee will pass on the suggestion that it should ask for feedback. I think also the learning, as I mentioned earlier on, the council has undertaken to aspire to be the best council. And in this context, it'd be useful to know what lessons can be learned from this work and what could be therefore promulgated further and wider within schools, perhaps wider, and also within the services council overall. I think it would be useful for us to recommend both of those as recommendations, but with the caveat that the officers should advise next committee the next year when would be an appropriate timing. So they could take those as things on board for consideration of the work programme, but also with a comment from officers as to timing, because no point asking you coming back next week about that, but perhaps in 3-6 months' time or something. So if I could draw that to a conclusion, then thank you very much. And thank you also for the work you're doing. Thanks. Very important. So we move on to paper A5, emotional wellbeing. So this item focuses on joint efforts between council and health partners to demonstrate good practice of early intervention to reduce demand in mental health services. Whether it's the difficult balance between giving help to the most needy, those who are intermediate, and then better provision to perhaps help the general population not rise up that needs trying, and that's always a very difficult one to address. So I appreciate what's been said there. The report in two parts. Cover report sets out the overview of emotional wellbeing and mental health services and details the approach, the emotional wellbeing and mental health plan. Whilst the draft plan is attached to the appendix. Generally, we've been invited to provide any feedback regarding this paper and early, particularly in relation to early interventions. To consider the emotional wellbeing, mental health plan, cyber committee wishes to make it. So thank you. We've also been joined with Dr. Annabelle Saunders, and we've got FTN, and we have Lawrence Chuck as well on Central Northwestern NHS Foundation Trust. Thank you very much for coming with us and also these books. As before, we've read the papers and we take them as read. So we're not going to go through the paper in detail, but I think it'd be useful if you could put out them perhaps the top 2 or 3 points that you'd like us, in your point of view, to focus on. We won't necessarily stick to that paradigm. It'd be useful to know what you think is particularly important.
So I was going to signpost some of the key points, but before I do a thank you for that introduction. I did just want to give Lawrence an opportunity to introduce himself, and thank you so much for joining
That
us.
would be very good.
That's okay. Hi everyone. I'm sorry I joined late. My name is Lawrence Chung. I'm the service manager for CNWL Early Intervention CAMS. So I look after our single point of access, our children and young people's primary care mental health service, and our newly developing early intervention team within Kensington. So great to be here today. Thank you.
Thank you. So I don't want to go over what you've already read, but to highlight. So I think this is our third emotional wellbeing mental health plan, and for us it's a way to attain commitment across councils, the children's public health, but also across our health partners in terms of a unified vision, unified principles and priorities. And in doing that, it's been really helpful for us in terms of embedding a more coordinated and joined up approach to emotional wellbeing and mental health. And particularly, I think the key bit has been about strengthening that early intervention support and trying to provide more support earlier upstream to try and minimise the need for more kind of complex or specialist support services. I think this is a priority. We've all seen sort of the national picture in terms of emotional wellbeing, mental health needs within young people, and we know that this paper includes a line about the prevalence of mental health needs kind of forming within our kind of under 17-year-olds and becoming quite entrenched. So the offer within children and young people, or for children and young people, is absolutely critical. The report does talk about some of the areas where we feel we've made progress. I think a key one, since we were last here with the report, has been that we have got every school, every maintained school has a mental health support team, and we've worked really hard to make sure that the pathway works. So that early intervention links in with our CAMS offer through operational sort of step up, step down conversations. And I think what we really heard last time that we've been focusing on and working towards is better promoting our offer. So there's been quite a lot of work to do that, and yet we still hear that kind of awareness of our services is still a priority. So recognising that that's going to be an ongoing piece of work for us to continue to promote our services and also destigmatise our services. And in there is some data about the impact and numbers attending and so on. But hopefully it gives you a good sense of both what we've achieved, but also some of our priorities for the future. I think being a little bit more detailed in terms of those future priorities than we have done previously. And then I'll close on saying there is always more to do in this space. This is an ongoing priority, it will continue to be so. That's one of the reasons for bringing it to you, to hear your thoughts as we firm up our third emotional wellbeing mental health.
Do you want to add anything? Or?
I think you've summed it up, but I think there are a few things in here like the Confident Communicators programme. So some of the, I think what might be interesting, I'm sure someone will ask, was what's different, what have we added since the last time that you came that you might want to explore?
Okay, let's go around the table. Tom,
yeah, thank you. And then, thanks for the introduction. And it seems like, in terms of as an offering for people with mental health problems, it's no expert, but it seems like a very, very good offering and also a focus on early intervention. But my question is about the sort of prevention side, and to what extent do we see a role for us as local authority in preventing poor mental health? And specifically, I'd like to ask about social media, which has been talked a lot in the popular press about the sort of leading cause of this rise in anxiety we're seeing. And the sort of is slightly anecdotal, but I've heard sort of a lot of parents say to me who have kids sort of between the ages of 10 and 14, we know social media is bad for our children, and we know smartphones are bad, we don't really want to give it to them. But all their friends, is sort of a tragedy of the common situation, all their friends have them. So if we don't give them one, then they're socially excluded. And so is that better than banning? So I just wonder, of course, to ban it, that would have to be national legislation. But do we see a role in prevention and providing guidance, which could at least maybe give parents something to hang their hat on a bit more, say, right, there's guidance from the borough saying don't let your children on social media, for example, before the age of 14 or something like that. What do we see our role as in that?
Can I add to that?
I've got something I want to add.
That seems to be we're going to go around the table, not all at once. We have an answer.
Prevention more broadly was the first part that is a larger part of your question, absolutely. And this plan has been developed with public health. You absolutely see the prevention agenda and emotional wellbeing, mental health being a core part of their business, as do we. So part of our, I want to better joint working, strengthen our joint working, is to make sure that lots of our initiatives are aligned. So they through their school health, so school nursing as was service, now have a more a dedicated mental health lead within that school health service. Just one example of trying to make sure that it's a core part of some things that we might have already been doing. Our mental health support teams, they don't just do kind of one-to-ones, they do a lot of awareness raising, work on friendships, work on kind of social emotional language, articulation. We know that a number of schools have ELSA as well, emotional literacy support services. We've worked really hard to make sure that our youth services build a really strong part of kind of well-being into their programme. And we also know that the benefits of physical well-being are absolutely key to emotional well-being and mental health. And then linked to that prevention, just kind of that keeping well. We've made sure that all of our preventative services, including kind of enriching activities, are part of our mental health offer. And so public health have launched and they've got a wellbeing hub that is for all residents, helping parents too, and that links to our children's and young people offer and the campaign We've Got You, You've Got This, which we led on last year, we're looking to refresh. So prevention, absolutely.
And then just to add to that, there was a post-COVID survey with the Young Health Watch, which was asking about where you would most likely seek support and help. And actually the answer was from parents and peers at schools. And so we've really been trying to think about those different sorts of settings in our preventative agenda. So thinking about, we got this young people talking about problems and talking about sort of support to other young people, or we've been trying to target parents and thinking about how they might access support, or we've been thinking about, well, actually, young people go to school, yes, but actually they also go to youth clubs. So we've got a mental health youth worker going to the youth clubs to do services in those settings as well. So it's a kind of multi-channel approach that we're taking.
And just to add, and you might want to bring on this, was something like All Saints have done with their 12-hour day, where they're keeping people at school
That's
longer,
absolutely.
which was just,
bring that
well,
up.
you might want to talk more about it, which has been very
The whole point
interesting.
about social media is
certainly.
young people are trying to interact, aren't they, socially?
Mm.
So if you can't ban that, so
No.
it's just impossible to prevent it. Doesn't matter what age you say they can't do it until. What you have to do is offer them something that's better.
Yeah.
And actually they loved engaging with board games and
Yeah.
so on and so forth. If you make it a really fun place. So as that gets rolled out across other schools and other venues, then I think that's the way
Exactly.
we prevent the overuse of social
It's building resilience, isn't it?
Absolutely.
Yeah.
Absolutely.
So,
Thank you.
I was actually going to go around this way this time, so.
Well, the question's quite similar actually. So, yes, about screen time is mentioned as a factor, but I suppose rather than guidance, because I don't necessarily think it's the council's place to tell parents or children what they should and shouldn't do, but I do think that schools have a role, and can the council be proactive in engaging with I think lots of schools up and down the country are putting in their own policies about the use of smartphones and social media during school hours. Is this something that we can be proactive about encouraging council?
I mean, it's probably a question that I would put to my fellow director in Heggs, Director of Education. But I do know that he's having a range of conversations with schools, and as you say, schools are all looking at different solutions and what will work for their own school body. But you know, you're absolutely right. This is now something every school is having a conversation about and thinking about their policy on. And I am quite confident that it's also a conversation they're involving our school standards colleagues in terms of advice and best practice. But at the moment, there are a range of differing approaches.
Can I just chip in on that one thing, which is your point? I think no council would like to step in and take away the head teacher's prerogative around their own behaviour policy and how they choose to operate schools within, phones within their own schools is their prerogative at the moment. So that's a whole union debate, and it's quite a big deal.
I mean, it wouldn't necessarily be an intervention of that sort, more a campaign that we might endorse, or if there are various sort of parent-run campaigns, and
But what I could feedback is from my experience of being a governor in the primary age group, is that as far as I understand, because I've tried to talk to as many people as possible in the school forum of it, is that I understand that it is standard practice that mobile phones are banned from teaching hours in primary schools. The subject and the content is sometimes even dealt with digitally, but on school equipment, which is totally controlled by the safeguarding that can be put around that. And that then there are different policies with regard to children being able to have their own phone back so they can use it to be safe and communicate when they are getting to school and back again if they're the appropriate age group for that. When it gets into the secondary age group, it's much more broad arrangement, and I think the same paradigm of the head being in charge of the policy will attain, but there'll be a more greater variety in interpretation of that as children get on. But the key thing that also I get feedback on is that it's building this ability of the child to start discerning for themselves how to keep themselves safe, and that because that's really the only way out of this tech war between
I think it's
provide.
very difficult.
It is very
peer-
difficult.
With peer pressure, I think it has to come
Yeah.
as a rule in a school.
Yeah, no, sorry, in the school it has to be,
Yeah,
but to build resilience, particularly for when they're out of school, that has to be, because the parents also will be less present as children are older as well. So but it's definitely changing and emerging, and you know, from having 3 children not that far away, in age group, that you know, the matter of 5 or 6 years between 3 of them. There are different digital generations, those 3. So it is incredibly complex. They now tell us parents what we should be aware of. So, moving, Councillor Law, you also want to.
Oh, thank you, Chair. I think my question already touched on by other members. I mean, the screen time, as you mentioned it, there's a social economic factor. There's a bullying around the cause of mental health. But my question is around this mental health issue caused by these elements. We know the schools are self-governed, and the council don't have much control of how they function. Some schools got initiative like All Saints, which want to increase the hours of the operation and engage children in more physical activities. But it is really serious issue. The school will say, for example, a KA will say, you can bring your phone, but you need to be switched off during school time. Then children, when they leave the school gate in front of the school, will take their phones, and fights can break out. They record it. Then that recording goes to the social media, and then it leads to exclusion and other issues. So really, how can the local authority, the schools, can work together to address?
I think we're slightly straying off what's actually in the paper here, which I really recommend that the scrutiny committee looks at, which is actually what we are providing, which is a huge amount of services in schools, in youth clubs, to sort of divert children and give them other activities. Because I don't think we can address or solve the social media problem here in this meeting or in this paper, and particularly because we've got Lawrence here. And I think one of the things is how well we're working with partners in the mental health space, because often, it always comes back to the council, what are we doing, what's our role? But of course, your role is equally important, and maybe you'd like to fill us in a bit more of how you engage with us and work with us on this programme.
That would be great, thank you. I am just reflecting because I'm quite new to the trust, about 5 months in, and I think something that has been such a pleasant experience has been working with colleagues in local authorities, particularly to develop this really exciting Kensington and Chelsea early intervention team. And the reason I say that is because through national research, but also local understanding of our data, we're starting to get to the point where we know that when children and young people complete an intervention from within our children and young people's primary care mental health service, for example, we now can hypothesize confidently, actually, that reduces the onward reliance on specialist CAMs. And so we've got that kind of national research to back it up, and we're also slowly starting to see it locally as well. And it really does highlight the impact of early intervention and prevention. At some point, the sands must shift from, and there will always be young people that will require specialist CAMs. But if we were to kind of focus on that early intervention and prevention, it is meeting young people where they're at and families as well, ensuring that we're working hand in hand to actually our process is working for our staff and also our young people as well. And I really feel like I've got to work on that whilst working with Annabelle's team. So yeah.
I think it's a very interesting answer, because I slightly disagree with you, Catherine. I think that actually takes us back to exactly an answer to Councillor's case. It's the interventions that happen not just in schools, but in other locations where the services are provided, help build the resilience of children so that they can cope with the practical pressures.
That's what I was saying. I was steering it back.
And I think that there's a definite link up between the question that Arsenio was asking and this, and you brought the two parts back together. So thank you.
I think one of the principles in the plan is making mental health everyone's business.
Yeah.
And so that thinking about the partnerships and the systems that we work within, that's one of the driving principles to really develop services, improve pathways and promote what we have.
Yes, because I agree. I mean, one thing we all agree on that they're very fragmented. You know, there are lots of services, but they're all in different places, and it is very hard to navigate them. And that's what we are still working really hardly on. So whether it's through our comms, through your comms, through the schools, through parents, through all the group, the youth clubs, everywhere we are, it's that having a point of access that people can find out more, and that children themselves are aware of them, that they talk amongst themselves and say, well, you know, don't feel a stigma about talking about your mental health. You know, there are people that can, and that is, you know, the hardest thing to break down, is to say to a parent or your peer, I really am struggling. That's really, to me, that's almost the hardest thing that we have to keep cracking going. You know, as we've got in the stats here, that so many children feel like that. It's how do we say, we understand, and it's a horrible feeling, and we're all here to support you to move through that and be more resilient.
If I could pick up on that, ask Florence a question. Is that from your experience today, how do you feel that we can, going forward, improve with working through schools? Because one of the things that I'm analysing it and talking about as a government in an NHS hospital trust context, they were doing stats which included the footprint of the service with the patient cohort, and the footprint that the service of schools has for the patient, or consumer, if you like, cohort of young people is immense. There's virtually no other service that has 35 hours a week contact with the people that are providing the services, and that's before you get to the expanded day, which is a sort of standard basis. But on the other hand, then in the holiday time, it goes to zero unless you have out of school clubs or arrangements, which we know most schools do. The question is, how do you think, building on what we know and the evidence you have from the national studies, what best practice could be brought to bear to improve the effectiveness of the working with schools?
So within Kensington Trust in Westminster, although I don't manage the mental health support teams in this area, I do look after our mental health support teams in Brent, Harrow and Hillingdon. And the most surprising thing, I think, is always that with all the will in the world, schools and teachers and all the wonderful staff there simply just do not have the time sometimes, because they are dealing with so much stress on top of, volumes of work. And I think first we have to build a really good shared understanding in terms of the language between services and also schools. There needs to be an appreciation of how much time constraints they're under, and we need to essentially work around that. There is no point in me, saying, can you turn up to this Tuesday appointment, when actually there's no confirmation that's going to happen. It's going to provide much better value for to kind of reach out to the school and say, just let us know when you're free to have a chat, and we'll be there to support you. Because there's also a lot of support going into schools as well.
There is, exactly. Yeah, that's what we want to do.
I mean, building on that, so I think that's the key point. So I think what we've learned, the things that work really well with schools are the embedded offer, which is why mental health support teams are such a successful programme, because they're actually situated within the school and part of the fabric at the school. But obviously the important thing is that where needs escalate, they have those pathways into camps, and vice versa, to kind of support some of those wait times and step downs. But we also know through the work of All Child, again, an embedded offer within schools, take referrals for a range of reasons, but really try and support our young people to improve various outcomes, be that well-being, mental health, or academic or attendance, again, situated within schools. And again, our early help offer, we have Key Link early help colleagues who link with schools, and their role is also to understand the local landscape and the local services, and being able to support schools and families to navigate them. So I think from our perspective, it is about being within the school and having really good relationships within the school. And so in theory, all of those services are absolutely vital in helping schools and parents to navigate our kind of range of services. So I think that's key, and then obviously making sure that the range of services are clearly articulated.
And sometimes it's to do, I think, putting it another way, it's to do with a mutual understanding of what the roles are.
Yes.
And upskilling the understanding of the teachers in the school, not asking them to do extra work. I mean, in a couple of instances in the borough, we've now got autism provision hubs, which have been in the schools in these two schools for several years now. And it's had two major effects. One is that it actually provides a highly skilled service for those with severe need. I mean, we have most severe need go to special school, but having an autism provision in a general school provides a range of support for children with different parts of the spectrum. It also enables the general provision class teachers to understand how to look for signs that need early interventions or minor interventions. Children who are not of the level of need, they need to be in a hub. And one teacher told me recently that her aim was to take a child into the school who perhaps would spend 20% of their time in the general class, 80% of their time in the hub. And by the time they finished the primary school, they could be switched around the other way, 80% in general class, 20% of special provision, which would enable them to go to a general school at secondary rather than having to go to special school. It's those understandings. The no way that the general provision teacher aim to do the job of a specialist teacher in autism. So
and that's the piece that I mentioned earlier, the Competent Communicators Programme. So again, it's the early, really picking up early a child who, if nobody had noticed them, might go on and be have an EHCP plan. But probably it's because maybe they haven't had a parent read to them, or they haven't got books in the house, or they haven't been talking a lot with each other. That if that's picked up really early, then you can actually prevent them having that EHCP because you build in. And if we're talking about cost, the cost of having that to everyone as a taxpayer, and for the well-being of the child actually sort of stuff. So that, and also our delivering better value piece that we've got the £1 million funding for, which was all about training teachers in schools again to absolutely identify very early on where a child might be struggling with communicating and language skills, which we recognise is just absolutely critical.
Yes, and key link to well-being. If you don't have the language to be able to articulate how you're feeling, you are going to struggle more significantly. And and we see that all the way through into our youth offending service and criminal justice, there being a high speech language need. So I think it's all about those early services.
Yeah.
Okay, if I could move around the table to David.
Question one. There is on page 23 a chart which is pretty similar to what was on page 31, page 23. And somebody please give me an indication of what sort of percentage you achieve each quarter. I would find it very helpful.
So I can't give you the exact percentages, but what you'd expect is to see a downward trend.
Absolutely, but it's just how downward, and if there are lots of people who actually really need help, that's who need lots and lots of help. That's a really concerning indicator.
Yes, well, certainly what we do have is we've got figures from. So
if you want to put it through to me later on this week, that's.
We can do that. So we've included in here, and albeit it's North West London, but we've included here, I think, the tier 4 figures, which is more of your orange, getting tier 4 old speak, getting risk support. Then you've got more of your specialists. That's our CAMS figures, essentially, those accessing CAMS, which we have. Your targeted, that could be any of the mental health support team data, which again would include kind of in the back and appendices. And that universal is all children. It's all it's those figures are sort of in the paper, but we can pull them out and literally put them against those ones.
If you could send that'd be great. Afterwards.
Basically, that Luke will ensure that the secretary submit.
Question 2, very quick. I hope. What's the budget for this annual budget?
So, that's a really good question. I was thinking about it today. this budget sits across so many different pots and pools. So obviously we've got some public health initiative. Our mental health support teams, whilst we know the cost, they're not funded by the local authority, although we work very closely with schools to implement them. In terms of the things we fund directly, I mean, it's also a bit like the public health bit of a kind of specialist mental health nurse within school health service. Have we actually quantified how much that is? Lots of this is about building mental health support, not as a sole standalone contract, but into a whole range of our services. It's sort of an exercise we've done before to kind of cost up how much we spend on Cooth, which is an online kind of virtual support. It's something we can do crudely and have done crudely before.
If you send me, if through Lou, you can just send me something that takes you 5 minutes to do from the top of your head, that'd be fine. But I want to know roughly what it is.
It's
Is it
tricky.
100,000 or is it a million?
Well, I think, I mean, David, just look at the youth grants. So as we're saying, we've got mental health people in all our youth clubs. Now we know what that has cost us, 750,000 a year. But I mean, how do you know which percentage of the youth club is actually going to be dealing? So I'm just sort of trying to say that it's very difficult to extract from all the different what the actual cost would be, because they're all linked to embedded in other services.
Yes.
And that's why I only want to I want you to do a top of the head rather than a really detailed one. My third question is slightly different. Some of these are the macro indicators or things that would drive concerns about emotional well-being and mental health are hope, identity, lifestyle, and faith. When I looked through the report, there was one reference to hope in one of the services on page 28. There was one reference to identity regarding LGBT people on page 26. Even acknowledging that many people who are LGBT may have multiple identities, as indeed we all do. There was very little on lifestyle, nothing on diet, 2 on exercise, and 1 on sleep, and there were no references to faith. And these are all, to me, quite significant reasons why people might or might not have emotional well-being needs. I'm just not quite sure whether I should have been, when I did the word searching for it, whether they should have been there, whether I was expecting, well, that was an unrealistic expectation, and the sort of thing you would cover in what the providers, the individual providers are doing, rather than in this particular report. But if that is the case, I think it'd be really helpful to say these are the sort of things that are covered by the professionals.
I'm not sure that's a really interesting question. So all of these can be preventative factors. And, you're right. Lifestyle is such a key one, which we referenced. Diet, sleep, exercise, faith. All of these different things are kind of some preventative factors. And really, it's like we talked about emotion, like language around relationships, and friendships, and sort of social emotional language. All of these things are woven into interventions, and just taking that kind of the last one, right? Youth interventions, they're absolutely there. Of course, they're part of what All Child does in terms of some of their interventions. But they're a key part of how we engage with young people on that preventative journey, really. But no, I mean, we probably haven't gone to that level of detail. But what I think we could do, because some of this it isn't common sense in terms of what does that look like. I think we can bring to life some of the programs, some examples of some of what happens within, from our youth mental health workers within our mental health supports team, some of the interventions, some of how they shape some of their assembly work, their group work, the themes. We can certainly give a flavour of that.
Just as an example, perhaps, so the professionals that will be delivering some of these short-term interventions, it's based on low-intensity cognitive behavioural therapy, and within that lifestyle, physical activity is very much woven into that intervention and delivered. So I think although it might not be explicitly named, perhaps it's something that I think certainly in CAMS we would always be thinking about, because it's the only hope we've got.
And I absolutely accept that, but it's just not in here.
I also think that the questions of hope and identity and lifestyle and faith. I mean, so this is the health's kind of model of how to think about this. I think what it doesn't do is doesn't talk about the why, and the why to me is embedded in kind of issues with hope and identity and lifestyle and faith. So I don't think this paper talks about the why. I think we leave that with the professionals who are working with young people to diagnose. I think this framework is just thinking about where people are in terms of the level of need that they have.
Yes, it's not prescriptive.
Yeah.
I mean, you know, we can't say you can get that hope and that's.
No, exactly. But lack of hope is one of the things driving it.
Sure, yes.
And that's absolutely,
Because how you
yeah,
write that.
but I mean, we could get into social graces
Exactly,
and you can then go into quite a lot of detail as
Exactly.
to the why
Yeah.
and how, so why people have mental health. But
Yes.
or not.
Newspaper these days.
I know, that's my point.
So, but I think the aim of this is not to delve into why or
Yeah.
diagnosis. It's just to, so this is the model and it puts people on a kind of tier as to where they are on their journey.
But in terms of the how, we can give a flavour, a headline flavour of the
Yeah.
how.
Amanda, I think you had asked through. Yeah,
I
Amanda.
don't know if this is the question or mental. It seems to me from both papers that we read and also the national conversation, shall we say, that there is ever more mental, low level, should we say, mental health need across. A lot of it's self-diagnosed as well. It's coming out, young people feeling all manner of different stresses and things. Is the end result that we're hoping for is to teach resilience? Is that so? We don't want to keep them on this path. We're trying to wean them off it, as it were, by giving them the tools at the earliest possible opportunity to make them self-sufficient. Is that the whole aim of what you're doing?
Yeah,
Absolutely.
absolutely. Yes,
Yes. I just wanted to check. We haven't changed.
Right.
Okay.
The healthy lifestyles.
Yeah.
It's enabling people to be resilient.
Yes.
That's fun. No,
No, I haven't got
Yeah,
any
it was-
questions.
Question for Lawrence, Chand. You spoke about the engagement with parents, and quite often, I'm assuming you would say that, parents didn't turn off their appointments to, is that what you were referring to? And they're making yourselves available.
Yes, so to clarify, that was within a school setting, so with a teacher, and making ourselves available to suit the teacher's availability rather than with a parent. But we would try to work with the parents' kind of date schedule anyway to see when it would be convenient for them.
Right, so to expand this further, besides every parent, as the government says, watch adolescents. How are we trying to make parents more aware at an earlier stage, to understand? Because I think one of the things is very prevalent now, especially as children get older, teenage years, the disconnect between the parents and the teenage children with social media, etc. So, what is our, how much we try to help parents with that? Or can we help them in any way?
I think there is absolutely a role, and I think it starts with education and awareness. The young people that we see, more often than not, they're quite clued up actually about their mental health state. And so when we work with them, yes, it is about providing classes like online awareness, working with parents to support healthy behaviours. But I think it's embracing that people are going to watch these things on Netflix or whatever's the new buzz platform. And our role is to not only educate, but it's working with the system of being a person as well. Because actually, for a parent, it must be very difficult to see their young personal child on their phone all the time.
That's right.
And sometimes it might be that kind of peer support from parent to parent, alternatively, parent to professional, which helps to normalise that behaviour and say it might be quite hard now, but here are some tips and strategies that you might want to try. as a kind of non-violent, resistant way of working with each other.
Okay, that's.
Can I just add to that as well? I mean, that's what our family hubs and early help is absolutely there for. So either a parent might come in, or if a child has trouble, then realise that actually we've got to do an intervention with the family. I mean, I think one of the sort of rather sad things is that the number one help for referral to our early help is domestic abuse, and emotional well-being is second.
Yeah.
And so you can see where number one leads to number two. And therefore, it is absolutely that support with the parents is absolutely critical to actually help deal with the child's emotional health and well-being.
But I think I completely agree in terms of the referrals coming in. I think that the thing that is interesting is in terms of then when you look at the numbers of mental health factors mental health needs being a factor in our assessment of looked after children, or children becoming looked after as they move into social care, actually that's reducing. So although it seems like it's increasing at the early help stage, it's reducing at that kind of family breakdown point. Yeah. And so I think there is, and that's absolute testament to the work that's happening as a system within our family services, within early help, to try and support those families. And you're absolutely right to mention our family hubs. We've got a good number of parenting programs, as well as country specific kind of parenting programs and support, and all of that is about family resilience. And the other thing that we found to be really useful is the youth mental health workers are doing work with not just the clubs and youth workers themselves to upskill, but with families too. And so it really has to be a whole system approach to supporting.
I'm assuming that helps break this stigma down as well.
Absolutely, that.
Right. Chair, I just have two very quick questions. Do we have any data, and if I've missed it, forgive me, do we have any data of, since we try and do the early prevention, how much it has reduced long term of
Yeah, I mean, those are those difficult. I mean, so one of them is actually thinking about the referrals coming in to early help, but actually how many don't escalate in terms of a need. We're seeing the need come down in terms of our social work assessments and mental health being a factor. I think there is also something about numbers entering our CAM service and needs, and then entering kind of highest level, potentially tier 4. So, and they're harder to get. I don't know, Lawrence, if you have a view on it. I think my perception is that we are still seeing a significant number of referrals that are kind of lower early intervention school-based level, but we are we're beginning to see kind of less of it, or more of an evening off within our specialist provision. You may not feel like that.
I think I would be interested to see what my counterparts in specialist camps might think about it, but I think certainly from an early intervention side of things, we're getting busier in early intervention, and yes, that is due to kind of outside world factors, but I also think it's people being more aware of how to access support. And if we're able to get there early, not only do we reduce reliance on secondary care services or specialist CAMs, but also people don't lose that confidence, and their experience isn't ruined through their time in CAMs. And they're also more confident to seek support as an adult as well. So it's just.
What is the recurring factor? I mean, early prevention or at CAMs, that is quite a common factor that, brings on the mental health. Do we know? I know it's vast. So maybe this is something.
I would say personally, it is around kind of the use of social media, young people, but it's on par with things like young people not having the kind of self-esteem to go to school in the first place, make friends, all the things that was a lot easier quite a while ago.
Yeah, we should have some.
Yeah. Sorry, I was just going to say, I think the other thing about kind of tracking that intervention outcome is that since starting some of this early intervention, we have been through the pandemic, we have been through a cost of living crisis, so it's really difficult. It's really difficult to kind of show it down when we know that sort of least level of need. So that obviously kind of goes around the middle. But I think actually right now, just reassuring ourselves that the interventions that we're putting in place are having an impact, which is what you sort of one of the opening points you made. Certainly, it's what we look at with all of our interventions is, you know, what impacts it having. And sometimes you can say, you know, actually in terms of a school, we can see that been improvements. Sometimes for some of our more community-based services, it is more anecdotal and it's sort of understanding, kind of getting that feedback from families, from the young people themselves. But all of these services, we do look to evaluate absolutely and think about their impact. So right now, you know, that's what we're doing, and constantly looking at our service offer and where we need to kind of flex them.
Because personally, you know, year down the line, that's what I would like to know. You know, that how have you tracked it? And you know, is it having it? I'm sure it is, but somehow I think you articulated it much better than I do. It would be lovely to have some data on the tracking.
Maybe we could have a further feedback on this in the future, because we've opened up a big subject area here, and I think we've asked some interesting questions. But maybe we can move on. Do you have one more?
Just one very brief one. This has come up before as ethnicity. It's on your page 25. You know, things like fear, stigma, lack of cultural sensitivity, treatment can act as, you know, a sensitive treatment can act as barriers, all that, and especially from BAME backgrounds. And is that still very prevalent? I mean, because every time it's always there. Yeah. So and being.
Yes,
I would just like to.
It's a public health team, obviously. It's sort of more, but I mean, yes, it's still. It is. You can't deny it.
I mean, what we heard.
Is it on the increase, or do we say?
I wouldn't be able to comment on whether it's on the increase or not. But what I do know is mental health in certain cultures, or poor mental health, isn't seen as an acceptable way of talking about, say, you know, I'm struggling with my mental health. That is not seen as acceptable. And so we gave a lot of thought to it in relation to our comms campaign about not talking about mental ill health, but to really think about, you know, feeling healthy, being healthy, and well-being being actually quite kind of a more comfortable term that people could connect with. So yes, we've given a lot of thought to language. And yes, lots of our comms campaign was about trying to articulate what an intervention looks like, what you might be feeling, so why you might need it, and what might happen in that intervention, to try and sort of demystify it, but being really, really careful about knowing that there are certain terms in certain cultures that are just not comfortable, and we would lose engagement.
Yeah. Okay. Thank you.
I just wanted to check, because there was a statistic which was very concerning, and hopefully it's not true, but it says on national research, by age 17, 7%, I mean 7% of people have attempted suicide.
Which
No, sorry, page 25, nationally, and the final bullet point is nationally. Suicide is the leading cause of death. By age 17, 7% have attempted suicide.
I mean, of the 16 to 14.
Well,
That's still 5%.
yeah.
Oh no, I'd need to double check. My reading of this is of those who have, so up to 24, there's been an attempt at, you know, the age of 17. I think I'd need to take that one away.
Yeah.
I think that 7% would be highly alarming.
Maybe 7% of people who have
of the general population.
or something like
I think it's of those who
Yes,
attempted.
Okay.
but let us take that one away.
Yeah.
Come back through.
Got some data source in there, so I think we just need to track back to that.
If I could, on behalf of Kathleen Williams, who is not able to be here today, send me a page of questions, which I'm going to try to boil down to one sort of double question. It's to do with access for, and basically she's talking about for instance, the example is all child service she calls brilliant, but it's expensive to the schools, particularly if they're a smaller school. I think she quotes a figure of 21,000 cost to the school for that.
It's 10,000 a year. She paid half.
Right, okay. But I'm posing the question as she's put it, but I think what she's saying is that she has concerns about unequal access to support, which she recognises being good support. The question is there anything being done to make it more easily available? The other half of the question is to do with current waiting lists for assessments, and she quotes a year for ADHD, 2 years for ASD, and that since the CAMS waiting lists also are an area which she's concerned about. So is this a practical difficulty that we have? And what is is there anything being done to make it more available and shorter waiting lists? And what's the likely future?
The 3 components to that, aren't there? I mean, taking the waiting list point, I'm sure we've taken something to scrutiny to you before. This has been an absolutely kind of key focus across the local authority and health partnership to reduce those waiting lists. And health secured a quite sizable investment to help them reduce their waiting lists locally. And now those waiting lists are still, anything that's looking at sort of 52 weeks is still too high. But I think it varies under 5, over 5, and there's 2 different child development centres, so slightly different figures. But there's definitely been a near on halving of that wait time, the downward trajectory, and they produced some really our ICB colleagues produced some really interesting trend data in terms of the impact they've been able to have. So I think it's just to provide you with some reassurance that there has been an awful lot of work and investment, and there continues to be so in the wait times for those SD diagnoses. I mean, in terms of CAMS wait times, that isn't something that the local authority is responsible for. So, Lawrence, you may want to speak to that. I mean, I know that it's something that we always look at, but we know that locally they've been working to stretch targets of increasing the number of waits for under 4 weeks. But actually, in terms of our comparisons to other areas, whilst any wait is too long, again, we seem to be doing quite well compared to our national averages for CAMS waits. But Lawrence, be interested in your thoughts.
Fortunately, I don't have the kind of pleasure of managing our neurodevelopmental kind of pathway, but what I can speak to is the fact that within our single point of access, we do support some of our young people in terms of that kind of screening, initial screening questionnaires. And what we find is that because there is so much demand in specialist care, particularly in this area, there is actually an onus on the early intervention teams to see what we can possibly do to try and make that demand a bit smaller. So even doing that liaison between the GP, school, that will take out a lot of time that the local specialist care teams will need to do, all of that prep work. And I think it's only, this is one example, and you would probably need a whole theory of change. You can fill up with all the change ideas to possibly get some movement on this. But I think, within the early intervention service, we're certainly thinking of any way that we can support our specialists.
Because also the early intervention service would be linked directly into schools and such sites, and if they are skilled but not doing work, they will be able to do a lot of work to help on building resilience, which builds prevention and such like. So I think there's a virtuous circle there. But what are you indicating is that we're at the early stages of understanding how this works and implementing it. That we can see some early signs of it working, but maybe there's more work to be done. And that is going to be multi-institutional working. So we welcome you being here particularly.
I think what I do, Essie, help you remind me, I think that the other thing that we've been trying to work across the system on is if you're waiting for a SEND diagnosis or ASD diagnosis, or you're waiting for a CAMS appointment, it's what's that waiting well often look like? So what support are you getting whilst you wait? And actually being really clear that we've talked to you about a lot of support available in relation to kind of emotional well-being, but in terms of our ASD and neurodiversity, there's again significant number of interventions that we provide where you do not need that diagnosis, and again that's another topic for another scrutiny, but that's a really important part of how we design our services, that you're not waiting for a diagnosis in order to access support.
If I could now switch to a question that's been a series of questions. Again, I'll try to boil down to one or two. Sent to me by Jagdeep Birdie, who is a teacher, many of you know, in primary schools, sub-primary schools. And his area of questions is to do with the apps, particularly around Kooth and Best View and so on, as how widely they're known by young people, and therefore how easy they are to assess, how effective they are, and whether they're cost effective, how much do they cost, and how are they cost effective. And he parallels that with the question about whether the funding that's going towards the apps, would that be better directed at therapeutic support in schools, and is the choice being made because of cost? And really he's asking the question, this is a new, the apps are a new thing, a relatively new thing on the block, and therefore, do we have the evidence yet as to whether they're accessible, cost effective, and are working on a wide range?
I mean, the apps, we've had them for a good number of years now. So they have been around. They are, so we jointly fund, so the local authority joint funds with the ICB, Kooth. We don't fund any other apps, although we do know that there are national apps that are available. Kooth, I mean, in one of the appendices, we've included some figures of 1,600 junior people. That, unfortunately, is a by-borough figure, I believe, rather than a Kensington and Chelsea figure, which would have to look break down for you. The reach is quite significant. What we also know is that some young people, we've heard from young people that having that intervention, they don't always want a therapeutic face-to-face intervention. They want to be able to manage something virtually. Sometimes that text service, we've seen really increasing popularity in kind of like text therapy. And it's worked really well, particularly for our neurodiverse population who say they don't want to have a face-to-face interaction. Now, the other thing to say is Kooth might not be a standalone. Kooth might be some support that you get in that moment, but you're also accessing a range of other areas of support. In terms of how well it's known, we talked already about We Got You, Got This. So that's a youth-designed, youth-led comms campaign we ran last year. We're going to continue to run because we've got all of those assets and resources. And one of the things it looked to do, as well as raising awareness and demystifying, destigmatizing, was to signpost to support. And during our running of that comms campaign, we saw a 30% increase in Kooth usage. So what we do know is when our comms is working well, we are directly driving to our online services, and it's instant, it's accessible, and I think it's really, really important to have a service like that alongside a range of other talking.
Can I just say that was because it was on TikTok, so we switched to do it on TikTok because we were told by young people they weren't looking at anything else, and that's what had such huge results.
So in other words, it partly is useful in itself, but partly also becomes an initial engagement and pathway to other things.
It might be used alongside, and some people, it'll be appropriate for them to access other support. But I think the beauty of it is it's available in, right there. Yeah.
Do you think this is something that's becoming sufficiently significant that we ought to be looking at as a scrutiny committee next year, for instance?
I mean, I actually think it's part of our system. I think we just need to accept that it's part of our system and that we shouldn't have a single approach, a single channel. And that just as we're talking about more support in schools and youth clubs, within the family home, we're also talking about digital support on the.
There's multimedia.
Yeah, exactly.
Okay, just to speed it up, if I can switch to what might call this second area of questioning, which is, are the services in family hubs well known to the young population in RBKC? And what is their view of them, and how do we know that?
I mean,
it's not only we have a view that they're important or not, but how do we know that?
It's a much broader question, possibly I'd argue, than the remit of the paper. Family hubs do a huge amount across an age range, and part of our family hub are our youth hubs as well, part of our early health network, and we know that our youth hubs, our family hubs, sort of work together to make sure that information is channeled across the two. Beyond that, I don't think I could give you any more specific information. That said, I'm sure our early health colleagues would give you a lot more information about that particular, young.
I mean, I think perhaps what he's saying is that is a high proportion of the population, particularly those who have a need, which is making everybody engaging, or is it very much a niche?
I don't think it's niche, but I think you'll probably see. So family hubs are obviously for all age, and we're doing a lot more to make sure that our housing support is there. That we've got more health services there. We're co-locating our health visitors within our families. We're doing a huge amount. So I'm not saying it's just for our early, our new families. But what we do know is that our health visitors and our kind of new birth visits, that information is passed on to our family hubs. So we're making contact with families when they become a family and reaching out to them. So whilst I can't say they're an absolute kind of consistent universal offer, we are making contact with near enough everyone who's having a child and promoting our family hubs. So from that basis, yes, we're really good at promoting them. What I can't promise when we get to kind of young people's, possibly actually we've channeled our efforts towards where young people go, which is schools, new clubs.
Okay, I think we've been round the table. Everybody's asked questions. The only questions we've got. It's an enormous subject. I going to find it very difficult to sum it up, but I think the things that have stuck out for me are that there is evidence. We've heard a lot of evidence about emphasis on early awareness and early interventions. That evidence is beginning to appear as to the results of that initiative, that we're beginning to see in some areas already a reduction in high needs demand or higher needs demand as a result of that. And as you were saying, that even waiting well means that if you have a sort of more general needs requirement, and getting the right injection of early intervention help and can keep things at that level rather than escalating. I think it'd be useful in the future to find out more about that, because it will then have to have an effect on budgetary allocation. And it's very interesting you talked about the ICB, seeing the changes in the ICB. I mean, basically they had to reduce their costs by 30% last year, and by September they got a further 50% reduction, and a whole cadre of people have been taken out. So the way in which the health trusts work in relation to each other through a much reduced ICB management overhead is going to either release resources or incapacitate the system. The jury's out. Which way it's going to go. This is early days. I think that access to help, there's a lot of help available. A lot of what's in the report is very much written, I feel, from a producer point of view. It's highly eloquent and integrated in that sense. There's a question mark about how much awareness in the general population there is and whether it's easy to digest. Progress has been made, but I suspect that the sense is that more progress needs to be made. And the focus on enabling individuals, be they children or parents, to build resilience and well-being rather than negative language, ill health and such like, probably is a good thing generally, but particularly relevant in certain cultural and place contexts. And then how to engage the general population, general needs population, to reduce the needs triangle being pressured at the higher end, which is obviously the higher cost end, and getting that balance right. I think when I joined this committee some years ago, and even in adult social care before that, getting the balance between investment in dealing with high needs and obviously highly vulnerable to living, and then in prevention or building resilience is a difficult balance. And I think it's not just a philosophical question. It's really a question of where we put resources. And there is a tension in some senses between adult social care and children's, because if we do if we do the job badly in families, we're building the problems for adults in the future. And getting the right balance of resources across that and an understanding of what's that is very difficult. So I would like to suggest that we thank you very much for the presentation, and that we would like a further update in, I don't know what an appropriate timescale could be. You've certainly done several before. But Miss Mary got a question. I wanted to just to agree the fact that we would, as a committee, we'd like a further update on this particular subject. Now, what would be an appropriate timescale? Do you think 6 months or years time or?
I mean, I think it seems like we're here annually some way or other. So I think an annual update is just time to make progress against some of the commitments that we've set out here.
Yeah. So is that agreed for everybody, that recommendation, annual update, and then obviously certain components of this, because it's made up of a whole series of components of the strategy. We might come back to it earlier. Mary, do you have a point or question you wanted to raise?
I do. Thank you very much. Yeah, I was just going to suggest maybe there are particular elements to make it slightly easier.
Yeah.
But you'd say we'd like to take those out when we're looking at the data as those sort of initiatives. What have they produced? And they might be easier to focus on.
Yeah.
Than overall, or how all these services help people come or not.
I mean, that's a very good question. I would put it to the professionals. If you were to pick out of this portfolio of things within the strategy, what do you think the pinch points are? I mean, Lawrence, as fresh pair of eyes here, what do you think your view would be the most important thing for us as scrutineers to be aware of and ask further questions about?
I think for me, it would be to hold partners accountable to that iThrive framework. That framework really helps services kind of look at how, the young person is right in the middle. How do we organise ourselves to help young people thrive? And if we continue to use that language, I think we'll get that.
Okay. So Luke, could you capture that thought and make sure that it goes into discussion about the work programme for next year? Any other comments you'd like to make?
I mean, I think the point that you make about what are we doing to embed awareness and promote our services, it's something we've really put a lot of effort into, but it continues to be, we still hear from young people that they want more information, don't know where to go for help. And I think that's our absolute foundation to make sure that our services are well understood. So I think there's something about what have we done to better signpost across our BCS sector, across within schools, families, and so on, to young people themselves. So for me, it's about how we promote the services we have.
Maybe to parents as well.
Yeah, exactly.
Yeah. Okay. Well, with that, I'd like to say on behalf of everybody here, thank you very much indeed. Extremely thorough.
Thank you.
And therefore we move on to 6, which is our work programme.
Jen, thank you so much.
Thank you.
Thank you.
Thank
Thank you.
Thank you very much.
Good night.
So on the work programme front,
Thank you so much for coming.
we've got a report which is in the papers.
Annabelle, thank you.
Thank you. We have the report as in the papers. And just by way of a couple of extra remarks, in addition to the information in the report, I'd like to give a brief update of the committee's work in between public meetings. At a meeting on the 4th of February, the committee requested a briefing on complex care costs to get assurance that children and young people were being adequately cared for and to understand the key factors driving the high costs. Due to the fact that, due to the nature of the information requested, and to avoid public disclosure of exempt information, the committee was privately briefed by senior officers, and we did receive assurance that the needs of children and young people in complex care placements were being met. And the received details also and assurances related to the ongoing costs of the council providing the care. The area of concern rising in the briefing will be worked into the work programme 25-26. Now, you will appreciate some of you at that briefing and some of you weren't. It's important for us to make public the fact that we recognise that this is an area of difficulty for the council and the professionals involved. It's impossible for us to discuss in public the individual cases, and in fact, even generically, it's difficult because the numbers in the cohort are so small that it would be not difficult to identify people. It would be very easy for that mistake to be made. However, we also wanted assurance from professional officers at the highest level that the appropriate care was being provided for these individuals, and that they were also fulfilling their duty to examine the causes of cost and to see whether anything can be done to mitigate it in terms of our duty to use the public purse in an appropriate way. I think that that's all I'm going to say on this, but we put on record that we've done that, and that we will be asking further reports in the future. And if they need to be confidential in nature, we'll use the same thing. And if there are aspects that can be made public, we will certainly aim to do so.
Which I would say will over to you, and if you can organise with whoever the governors are a suitable phrasing of that.
Yeah.
Over to you.
Okay, thank you. Now, the next thing is for us to discuss and agree the development of the 25-26 work programme, including the topics. The first meeting on the municipal year of 25-26, because obviously we are reaching the end of this municipal year. And the first issue that I wish to ask you for your support is that we continue the terms of the 0 to 18 project for the Select Committee 25-26. That project started off as a mapping exercise of all the services within the council and also with partners, such as schools and NHS and such like. And it's been circulated to those bodies for their input. I think it's very, very useful as a mapping exercise to appreciate those items that work together. But I think it's now reaching the point where it needs to look at how progress is measured of children and cohorts of children going through, what the milestones probably the simplest one to illustrate it with is a child being school ready at a certain age, because if they go through daycare and nursery, they probably will be school ready unless they have very big special educational needs. But the evidence is that in many cases, if they come purely home care, that often they don't. They're not school ready, and this presents a problem for the admission to reception and also the progress of the child for the first couple of years in any case. So I think the idea would be to try to turn it into to take on board a more implementation kind of practical approach. And one of the aspects of that, Sarah Newman has asked us to look at specifically, us to consider when we wish to scrutinise, is that her view and of her team is that the one factor that measures achievement in relation to potential more than anything else is attendance. Whether that's the case or not, if the senior professional in our director in the establishment makes that recommendation as something we should scrutinise, I think it's useful for us to do so.
To what benefit though?
Well,
she says it. I'm sure that's true, but how
Whether
are
you're going to
we as scrutiny committee giving value added to the council by saying that she's right? Because I think she probably is right.
because we would then make recommendations to the council as to how they might deploy resources to supporting the various, and she clearly probably has asked for more resources there and is now wanting some support.
Her opinion is exactly that, as I understand it. She obviously, in these straight times, some pushback against that. And I think it's not for us to say.
I mean, ACE services, for example, things like that are extremely helpful, and maybe they're very under-resourced.
And what we ought to be doing is scrutinising whether what she's asked for is true or unreasonable or not. It might be in some parts of that we might need some help outside the council. I don't know. In scrutiny, we can.
Interestingly and anecdotally, and this goes back to what we've just been talking about. I happen at the moment to be taking a safeguarding lead in All Saints, and so in speaking with our DSL, one of the primary things they're really looking at now is attendance and putting much more emphasis as a school in how to bring the attendance up, because it then avoids some of these other problems. So I can actually see where Sarah's coming from.
And she's using this not just as a target, she's using it as an indicator. But what she's saying is that where there is an individual with poor attendance, you need to look deeper into that individual's situation. Then what are the causes of that? And then
is there a way the council can support it?
Are the resources there to do the early interventions to help that family out of that situation? So it was a very broad brush statement I made, but basically I asked her what was the one thing that she wanted us to focus on. Now, I think if she recommends that, I think we should at least consider that in our workshop on next year's program.
So you think you're having a working group on it?
Well, I think we should. We in the normal run of scrutiny enablement at the beginning of the year, our first meeting is a workshop on the work program, and we have a discussion about what we want to do. I think at this stage, for this committee, all we're doing is to put it on the agenda of that workshop.
Certain suggestions for a long list.
Yeah, fine. It's a long list suggestion. Yeah. And it's such a broad term and it has such broad meaning that we may then say, look, we need to take an aspect of attendance, either what it illustrates or what it results in, not as the child progresses further on. And then focus on one aspect of that. It may not be attendance per se, it may be some of the underlying reasons for that. So then I'd like to move on to go around the table. Work programme, any comments people want to make? So where should we start? Amanda, should we start with you? You okay? David? Abdul? Right. Are you happy with the paper we got so far? Is there anything you want to add?
I think in terms of local services, it would be ideal to have a look at it in terms of visits on the newly service commissioned by the council. New services and see who's delivering what and where are the gaps.
This is the commissioning through Young KNC. We had a paper how long ago? About a year ago. Young KNC. So what you'd be saying is that previously we had a report on how it's being set up. Now you want to have a discussion.
It may be early stage because it just started a couple of months.
Yeah.
So I'm not rushing. Could give it more time.
Well, if we put it into the discussion in the workshop or work program, we can then say yes, this is something we'd like to look at or not. So now we're putting it on the long list. We'll go for the short list. We put it forward and say that that's something we want to do, and then we time it. We take advice from officers as to when that's the right timing. So it may be yes, we'd like to do it, but not until March of next year or February or something of that sort. So
can we also ask Catherine and Mary if there's anything that they would like us to look at? That in perspective.
Yep. Mary, are there any particular issues you think that actually?
I haven't. No, I will get them.
Right. Okay.
But we note David's request to refer to.
Yeah,
Yeah.
that will also be happening because we're getting together a long list at the moment, the scrutiny team, so we're emailing out to lead members, directors, various different people. We're gonna contact the citizens panel as well and get ideas from them, topics, and then we'll have the workshop, which isn't a public meeting, but a meeting with the committee. And then those ideas will be brought down to a shortlist, and then at the first meeting of the new municipal year, you'll all agree the shortlist, the work programme for the year.
I don't know, but you can see programme commissioning was your thing. Was there anything else you wanted? Well, you can bring things up and when we go through that process that Bella's just described, anyway, you can add to it, but if there's anything. Sonia, is there anything particularly? Okay. Okay. I think we ought to did we put sort of budgetary constraints and such like? Because I think that one of the things that we ought to do is to make sure that we have an update on there was some overspends earlier in the 24-25 year, which officers said that they could mitigate by the end of the year. And as Mary pointed out, if they don't get mitigated, they become part of the built into the budget for next year going forward. So what we want is an answer to whether those mitigations have been achieved or not. That then helps form the basis when we start with the budgetary examination 25/6.
They may not know even yet.
Well, in terms of 24/5, they ought to know pretty soon.
Yeah, but it's now early May, and they may not.
No,
it's not signed off.
We're having this. They'll have a good guess of whether they've been mitigated or not by now, and by the time we have the workshop, they will be able to know. But and even then, it's a work forward from that. So I get your point on timing and sign off. So another thing we need to build into, they have had a good track record in FCS on transformational work. They did warn us last year that the areas that were available to transformation, well, they've taken the low-hanging fruit, to use this phrase, and that there's much left. The question is, how are they going to improve the efficiency of their service to deal with budgetary pressures in the future? And then allied to that, one of the transformations is if they are beginning to get evidence with regards to early interventions, really having a reduction of high needs services in the future, that's going to become a discussion that doesn't only involve FCS, but also potentially involve, say, ASC as a combined thing. Because you can't put ASC and FCS into two separate boxes. A child who's 18 goes one day in one and the other day and the next day and the next one, it's the same child. That was the good thing. Any other issues on work programme? Okay, thank you for that. And that's any other points that we need to bring up? Some information. I think I covered the chairman stuff earlier in the done. Thank you very much, everyone.
Thank you.
Thank you.
And I think we should congratulate the councillor sitting opposite me on his elevation next year.
Yes.